Foster is used to help with asthma and chronic obstructive pulmonary disease in people who need regular treatment. How to use Foster? This video will show you the general steps for using an inhaler correctly. Please follow the instructions. Before using for the first time, shake the inhaler for 5 to 10 times. Remove the mouthpiece cover. Before using the inhaler for the first time, you should test your inhaler to make sure that it is working properly. Before using for the first time, prime with one test spray into the air and away from face to make sure that it works. Connect the extension tube with the inhaler. Replace the mouthpiece cover. Shake the inhaler 10 times. Shake the inhaler well before each use. Press down the inhaler to release one puff of medicine. Breathe out gently and slowly away from the inhaler to empty your lung and you feel ready to breathe in. Remove the mouthpiece cover. Put your lips around the end of inhaler to make a tight seal. Place the mouthpiece between the front teeth and seal the lips around it. Keep your tongue under the mouthpiece so that it does not block the opening of the mouthpiece. Begin to breathe in slowly and deeply for 4 to 5 seconds. This action is like using a straw. Take an inhaler out of your mouth and with your lips closed. Hold your breath for 5 to 10 seconds. Then breathe out away from your inhaler. When you have finished, replace the cap on the inhaler. It is wrong to press twice consequently. It is wrong to take a big breath hardly. Not holding your breath after inhaling is wrong. Before using the inhaler for the first time, you should test your inhaler to make sure that it is working properly. Before using for the first time, prime with one test spray into the air and away from face to make sure that it works. Use your inhaler as prescribed. If you have been prescribed a second puff, please wait 30 seconds, then repeat the steps. After using the inhaler, rinsing your mouth with water and slip it out to reduce the chance of side effect. Store the unused inhaler between 2 to 8 degrees Celsius until you are ready to use. After first use, store the inhaler for a maximum of 3 months below 25 degrees Celsius. Each canister contains 120 doses of the medicine. Each time a puff is released, the number on the dose counter will count down by 1. Do not use your inhaler if the dose counter shows 0. When the dose counter shows 0, you must dispose your inhaler. If you find it difficult to use your inhaler, talk to your doctor or pharmacist. It may be better for you to using something called a spacer device. For example, aero chamber.
辅助舱的面罩大小不同，成人请选用蓝色，孩童请选用黄色。雾化吸入剂加上辅助舱的使用方法介绍：上下摇药10下，插入洞口，按压1次药剂。面罩紧贴口鼻，嘴巴张开，正常呼吸30秒。注意叶片必须有规律性摆动。先准备一盆干净的冷水，再将插药孔的橡胶拔开，接着将辅助器的面罩与腔体 的部分旋转开来，一起浸泡到冷水里面15到30分钟。面罩端可以使用棉棒轻轻擦拭半膜处。擦药口也可以同时使用棉棒去擦拭。接着使用湿的纱布或海绵清洁腔体的内部，请勿使用菜瓜布或刷子，以免破坏管壁静电膜，影响到吸药的品质。清洗完毕，放置于桌面自然晾干。组装时必须注意面罩上的孔洞与腔体的凸起处，先对齐之后，往上旋转到咔一声，完成结合，再将擦药孔上的橡皮圈上面的凸起处对准面罩的吐气阀与瓣膜处插入，即完成组装。